Let's now look at our osteoporosis encounter assistant. F2 BMD encounter assistant. Choose this form. Again, you see the information being pre-populated, and you can actually access the 10-year risk fracture tool, but this tool is integrated into the encounter assistant. There's a link to CAROC, and there's a link to FRAX. So according to our bone density, it deemed that our patient was at low risk. And then we go through the questions. Whether she's had previous hip fracture would bring her to high risk. Spine fracture would bring her to high risk. Non-vertebral fracture, 1 would bring her moderate risk, and 2 would bring her at high risk. If she had been on steroids, so let's say our patient is in fact a moderate risk patient, we should examine our patients to assess for physical evidence of osteoporosis, such as this. And then we assess for risk of falls, whether successful or at risk. If your patient is deemed to be at risk of falls, you can actually refer to the fall prevention program with an automated message to your staff. The practice guideline suggests that you should perform a lateral thoracolumbar x-ray. When your x-ray comes back, you then assess whether there's fracture, compression fractures or not. And the screening blood test here, you have a pre-populated laboratory requisition. So let's say our patient did have fractures. So we now have selected yes, as based on the questionnaire above. And by so, we know now that there's good evidence that the patient would benefit from pharmacotherapy. Here you can go quickly to the reference guide or to the Osteoporosis Canada website to look up the different medications. This encounter assistant also pulls the last EGFR from your chart. And based on the last EGFR, your choice of different pharmacotherapies. If we want to check the product monograph, and if we wanted to check the different LU codes, we want to encourage basic bone health with exercise, calcium, vitamin D, and here we have handy links like the previous custom form. Pharmacotherapy also involves vitamin D. This encounter assistant pulls the last vitamin D level. And we have an automated requisition that we can add to the notes and give to the patient. The vitamin D level should be done only after 3 months of taking vitamin D. This would send a delay message to your staff to call the patient as a reminder to go for the vitamin D blood test. And of course here, we want to repeat our bone density in 2 years.